Assalamu alaikum. The unit which we are going to start today is the disorder of fluid and electrolyte balance. So I will start with the brief recall of your physiology. First, the composition and compartmental distribution of the body fluids. So, we all know that in a 72 kilogram healthy adult male, the total body water volume is about 40 liter, which is 60% of the body weight. From this 60% of the body weight, the 40% is intracellular fluid, which is 25 liter, and 20% is the extracellular fluid, which is 15 liter. Among this, 12 liter is interstitial fluid, and plasma is 3 liter, which is 20% of the extracellular fluid. And then here we see the concentration of important extracellular and intracellular electrolytes. This table is from your book Fourth Pathophysiology, so you can memorize these all of these important ranges from there. As you can see, sodium is mainly extracellular, where it is 135 to 145 milliequivalent and lesser in the intracellular. However, potassium is 3.5 to 5 milliequivalent per liter extracellular, and it is far more in intracellular. So it is intracellular positive ion. And then there is chloride, 98 to 106 milliequivalent per liter extracellular. So it is very little quantity in intracellular. That's why it is also basically extracellular ion. And then bicarbonate is 24 to 31 milliequivalent per liter extracellularly, and calcium is 8.5 to 10.5 extracellular and less than 1 milliequivalent intracellular. Phosphate or phosphorus is 2.5 to 4.5 milligram per dl within extracellular fluid, and it is up to 4 milliequivalent per kg in intracellular, but its concentration is higher in bones because in bones phosphate and calcium are deposited. And magnesium is 1.8 to 3 milligram per liter extracellular, and mainly it is intracellular, that is 40 milliequivalent. And this is a brief preview of your previous picture of total body water and the compartments. Here you can see that sodium is mostly in extracellular fluid, that is interstitial space, where it is 140 millimole per liter, and intravascular, where it is also 140 millimole per liter. However, potassium is less in extracellular fluid and more in intracellular fluid, so the potassium is on the average 4 millimole per liter in interstitial as well as in plasma. And now come the forces through which the fluids move from the vessels and within the vessel. This is there are two phenomena, diffusion and osmosis. Diffusion is the movement of solute particles from a higher concentration to a lower concentration. Here you can see the solutes are concentrated over here. They will disperse throughout the solution where there is low or no concentration of the solute, so that they achieve an equilibrium. However, the osmosis, it is the diffusion of water molecules from a concentration of low solute toward the high solute concentration through a semi-permeable membrane. Because of this semi-permeable membrane, these solutes from their higher concentration cannot go out towards their low concentration. To achieve equilibrium, they attract water towards themselves, so the water moves from here to here, leading to the raised level here, however achieving the equilibrium of the concentration. And the pressure which causes the flow of water or which pulls the water across the semi-permeable membrane is caused by the presence of these solute particles, and more the solutes, more will they exert the osmotic pressure, and hence the osmotic pressure is equal to the hydrostatic pressure needed to oppose water movement across the membrane. And then comes the measurement units of body fluids and electrolytes. The amount of electrolytes and solutes in the body are expressed either as milligram per deciliter or milliequivalent per liter or millimole per liter. So what is milligram per deciliter? It is the weight of the solute in 1/10 of a liter or in 100 ml of a solution. What is milliequivalent? It is used to express the charge equivalency for a given weight of an electrolyte. And what is millimole? Millimole is 1/1000th of a mole or the molecular weight of a substance expressed in milligram. And what is electroneutrality? As the name indicates, electro means charge, neutrality means balance or equilibrium. It means the total number of cations or the positively charged ion in the body is equal to the total number of anions or the negatively charged ions. Hence, 1 milliequivalent of sodium has the same number of charges as 1 milliequivalent of chloride, although the molecular weight of sodium and chloride are different. And also, sodium is positively charged and chloride is negatively charged. And now we come to the formulas of this milliequivalent and millimole. And what is the formula of milliequivalent? 1 milliequivalent is equal to milligram per deciliter multiplied by 10 multiplied by valency divided by atomic weight. Then what is the formula of millimole per liter? The number of millimole per liter of an electrolyte is equal to milliequivalent per liter divided by valency. And then comes the osmol. As you can have an idea from the name, osmol measures the osmotic activity or the diffusion of water through a semi-permeable membrane. The osmotic activity that non-diffusible particles exert in pulling water from one side of a semi-permeable membrane to the other is measured by a unit known as osmol, and 1 osmol is equal to 1 gram molecular weight of the non-diffusible and non-ionizable solute. And the osmotic activity of a solution is measured in two ways, either by osmolarity or by osmolality. There is a slight difference. The osmolarity means the osmolar concentration in 1 liter of a solution. However, osmolality means osmolar concentration in 1 kilogram of water. So, since 1 kilogram of water has a volume of 1 liter, so in human body we assume that osmolality is equal to osmolarity. And osmolarity is usually used when referring to the fluids outside the body. However, within the body, when we measure the fluids, we use the term osmolality. Hence, for the serum and also for the urine, in both cases we use the term osmolality. And serum osmolality, its normal range is 275 to 295 milliosmol per kilogram, and it can be calculated with the following formula. Osmolality in milliosmol per kilogram is equal to 2 multiplied by sodium millimole per liter, that is 2 parts of sodium plus glucose in milligram per dl divided by 18, 2 parts of sodium plus glucose divided by 18 plus blood urea nitrogen divided by 2.8. Why we divide glucose by 18? Because 1 milliosmol of glucose is equal to 180 milligram per liter. And why BUN with 2.8? Because 1 milliosmol of urea is equal to 2.8 milligram per liter. So normally the calculated and the measured osmolality both are within 10 milliosmol of one another. However, if the osmolar gap, that is the difference between calculated and measured osmolality, is more than 10, if this gap is more than 10, it suggests the presence of an unmeasured osmotically active substance other than sodium, glucose and blood urea nitrogen, which may be alcohol or acetone or mannitol. Now there is another concept which is known as tonicity. What does tonicity means? Tonicity means the strength or the tension or effect that an effective osmotic pressure of a solution with impermeable solute exerts on the cell size because of the water movement across the cell membrane. What is the effective osmotic pressure? Or what is the effective osmol? Effective osmol is that solute which exerts an osmotic force and cannot move through the cell membrane, for example glucose. What is the ineffective solute? This is ineffective osmol is a solute which can exert an osmotic force but which crosses the cell membrane, for example urea. Because the urea is lipid soluble, so it easily permeates through lipid bilayer of the cell membrane. So the tonicity is determined only by the effective osmol or effective solute, for example glucose, which cannot permeate the cell membrane, hence produce an osmotic force that pulls the water into or out of the cell. Now, based upon the tonicity, the solutions can be divided into isotonic, hypotonic, and hypertonic. Isotonic solution, it has this, as the name indicates, iso means the same effective osmolality as intracellular fluid, that is 280 milliosmol per liter. However, the hypotonic solution means lower effective osmolality than intracellular fluid, and the hypertonic solution means it has greater concentration or effective osmolality gradient than the intracellular fluid. In the isotonic solution, if we place a cell, the cell will neither shrink or swell because the water will freely move between from the cell to outside and back to the cell. Example is 0.9% sodium chloride, which is also known as normal saline because the tonicity is normal. Hypotonic solution, when a cell is placed into the hypotonic solution, they swell as the water moves into the cell. And when more and more water moves into the cell ultimately bursts. For example, half saline or 0.45% sodium chloride. And hypertonic solution, when a cell is placed within a hypertonic solution, the water will be attracted outside of the cell to maintain equilibrium, hence the cell will shrink in size. For example, if we mix the half saline with the 5% dextrose, the concentration and the tonicity of the solution will increase and it will cause the cell to shrink. Here you can see the isotonic solution. The cell has maintained an equilibrium with the solution already, and in case of hypertonic solution the cell is swelling, and in hypertonic solution the cell is shrinking. And from the total body weight, the intracellular we said was 40%, which is 25 to 28 liters, and the extracellular fluid was 20%, which is almost 15 liter or 14.5 liter. From here 10 liter was the interstitial fluid and plasma was 3.5 liter. However, there is a third space which is known as transcellular space. The transcellular space fluid is 1 liter, which is almost 1% of the total 60% body water. And then the exchange of this fluid at the capillary level takes place due to both the diffusion and also to the attributable to the osmosis of water, depending upon the colloids or the osmoles which are present within the capillaries and which are present in the interstitial fluid. So here you can see four types of forces are taking place. First is the capillary filtration pressure or the capillary hydrostatic pressure. It pushes the water out of the capillary into the interstitial space. Then is the capillary colloid osmotic pressure. It is exerted because of the presence of colloids and osmoles within the plasma, which attract the water or pull the water from the interstitium back to the capillaries. Then comes the interstitial fluid pressure. Interstitial fluid pressure is the pressure which opposes the movement of water out of the capillary. This pressure, interstitial fluid pressure, it uh, causes the water to remain or retain within the capillary. However, there is also another term which is tissue colloidal osmotic pressure. This is also known as tissue hydrostatic pressure. It pulls the water out of the capillary into the interstitial spaces. It is because of the presence of solutes within the interstitium. So that's all for today. Inshallah, in the next lecture, we'll discuss these all pressures in details. Thank you so much, and please remember, when the world seems a mess like Corona, go inside and discover yourself. You all are at your home, so you can explore your talents and your strengths, and you can overcome your weaknesses by studying more and by doing more of good work which you can. Good luck and thank you.